Okay, so
should we sit over there or just move it? What do you think?
oh, y'all
Sit
probably
next to each other?
yeah, y'all. I think she said it as people have to request to join, so you can admit them once y'all are ready. Okay, so it'll start popping up and you'll just admit them. Share screen is right here, so you'll pop share screen, then go back to your Canva, and click full screen when y'all are ready to share the slideshow.
Okay.
And Kristen, on chat, that's where you'll be able to see all the participants. So make sure you have a pen to write down everybody that's on, and that way we can give them their credits. Okay.
Okay. For people in the waiting room, oh God. I mean, should we keep your mask on? I don't know. Maybe we'll do one at a time. Sit like over here, so that way it looks like we're social distance. Yeah. Okay. How many people do we need to wait for?
There are 24 registered, but I would start because you only have 40 minutes.
Okay. Let me get my verb out, sorry. You ready, Kristen? Yeah. Okay. That's great there. So Liz, just to confirm, I'm just reading basically what the slide says, and you want me to just kind of communicate on what each of those little
those are just like bullet points to remind you what to talk about.
Okay. Mm-hmm. I don't even know what that slideshow says. Hello, everyone. Welcome.
Hello. Here, let me here. I'm gonna start the video. There we go. That's better.
We've got a total, I think, of about 24 people that are registered for this. I'm going to kind of mute everyone so that we don't have people talking over each other, but we'll do a little question and answer at the very end. I think people are still jumping on right now. So for those of you who don't know, I'm Angela. I'm the nurse practitioner in the office. This is our lovely front office person, Kristen. So we're going to talk a little bit today about what it looks like when you come into our office, what we will be discussing and kind of talking to you about, things like ALI, brilliant distinctions, if you're in for different appointments, what that looks like. Just making sure everyone is muted. Okay. Oh, somebody's outside, I think. And you don't have to have your video on if you don't want. A few more people coming in here, bear with us. Probably wait till about 5 after, so we can give everybody a chance to jump on. Thank you guys so much for joining us. We really appreciate it. We're going to be doing these webinar Wednesdays, or is it webinar Wednesdays or Wednesday webinars? I don't know. On Wednesdays, we're going to be doing educational things. Dr. Camp is actually going to be doing some surgical webinars as well. So you get a little bit more education from us. So that's what we want to be able to offer you guys. So thanks for joining us. Got one more person coming in here.
Pretty good. I got this done.
All right. Okay, so I'm gonna go ahead and get started. Give me a second to share my screen here. Stand by. Stand by.
There we are.
Yeah, it's not pulling up. Here we go.
Yeah.
There we go. Share screen. All right, here we go. Your first visit, welcome. We get a lot of new people. We have a lot of regulars. Some people know some of the information that's coming up and some people don't. But we love new people. We love old people. Old people, not old people as
Mature.
in, yeah, no, existing. Doesn't matter what your age is. So things that we're going to go over: your initial contact, you're welcome, taking photos, your consult and treatment planning. So, you know, anytime you come in, we're going to be talking about what we think you would benefit most from, home care and follow-up, and then rewards and communication. So this is us. This is the bow tie babe. So everyone's here with the exception of Dr. Camp. From left to right, we have Lindsay, who's our esthetician, lovely Kristen here, Sarah, who is our business director, Kelly, who is one of our surgical coordinators, Becky, who is our front office manager and surgical coordinator, Casey, who does a lot of the web leads and kind of front office stuff, also marketing, myself. I'm the nurse practitioner in the office, and then we have our nurse injector, Miss Liz, who is also amazing at basically anything we throw at her. So emails, we get a lot of emails from people with questions about what we offer, what's available, pricing, all that kind of stuff. We do check emails.
Yes. So most of our emails that come in, we try to get back with you guys as soon as possible. We want to be able to chat a little bit about your interest in what you have, and we can talk about pretty much everything. So we'll talk about pricing, downtime, and this isn't just for surgical. This is also going to be non-surgical as well. So we'll get into pretty much anything. So downtime, look at consultation days or consultations with our providers that aren't with Dr. Camp. And once we get you scheduled, we do want to go over a little bit of your medical history just to make sure that you're a good candidate for these treatments or surgeries. And basically, once we get you into our system, we will email you all of that to fill out for your medical history. And then basically, we will assign you homework too. So that homework, it sounds serious, but it's really just the fun part where you can really just look over everything that you're about to be doing and getting into, so you can kind of understand a little bit more. So that way, when you come in, you will have a little bit more background on how things are going to work, so you can be a lot more prepared and ready to go when you come in.
Yeah, and don't feel like you have to ask every single question via email or phone call. We do a really good job at providing a ton of education during your appointment so that you feel like you're fully informed and you know what's happening before you move forward with anything. Anything else about that?
That's pretty much it.
Okay. So our COVID protocol, and Kristen can speak a little bit more to the check-in process, but basically, you know, we want to do everything to keep people safe. COVID is a real thing. It's kind of rampant right now. And we want to be able to provide all the services that we have in the safest way possible. So we do ask that you don't bring anyone with you. If you're a new surgical patient, you can bring whoever is going to be helping you with post-surgery. Obviously, that's a big part of the whole process. So that's real important. But if you are an aesthetic patient, unless you have some sort of disability that needs to be accommodated for, we really ask that you leave friends and family at home. We will have you come in and do a screening form for COVID. It's a few questions. It's super simple. If you're symptomatic in any way, shape, or form, we really appreciate it if you just call us, even if it's the morning of, 5 minutes before your appointment. We would much rather have you stay at home and recover than do anything to unnecessarily expose anyone. So Kristen will go over a few more points.
Yeah, so first thing we'll do, get your temperature and have you fill out a couple of COVID sheets. And we mostly just want to make sure, like she said, that you don't have any symptoms, and now is the best time for you to come in. Everything's going to be safe. We do have a couple of extra sheets that we will have you sign. So those are going to be just checking in, consent forms. So we of course will have like financial policy and treatment consents, of course. Also, we really are like really important things are going to be pictures. We really want to get before and afters on every single one of our patients, not just for social media, but also for the provider's case. So we want to make sure that we can provide the best before and afters for each patient that comes in, so they can look at our past clients and see what their experience has been like. So another cool thing that we like to do on like skincare and non-surgical side, it's a Vizio, so it's a skincare analysis. So what we'll do is take pictures of your skin, grade it on a lot of different properties. That way we can really focus on what needs to improve. So that way we can provide a better treatment plan and get you where you need to be and make sure that your progress is really good.
The Vizio and the high definition photos are very important for any patient who's considering doing laser treatments. If you're going to be committing to using any sort of medical grade products as well, because it is able to look at every last little pore and spot on your face. I mean, we have the ability to zoom in on these photos, and a lot of people get a little bit scared. I'd be a little bit scared myself, but it really does show some great changes when you're really consistent about your home care or any treatments that we perform in the office. So, and the Vizio, it's not anything we charge for. It's actually something that we really encourage you to make an appointment for, so that we can just help you analyze and get a better treatment plan going. And sometimes if we do a procedure, like let's say you come in for a laser and we reanalyze with the Vizio, if there's still, something that we need to continue to be working with, like, if you've been using home skin care, like a resurfacing product or a retinol, it helps us to just be able to guide that a little bit better. So this is a picture of what the Vizio looks like. So we take photos from the front part of your face, the right side, the left side. It gives us what your skin type is. So this little bar of the different skin colors at the bottom has to do with the melanin production in your skin. All the photos are super unique. Nobody's numbers are the same. We kind of go over the interpretation with you so that you have a better idea as to what's happening with your skin. Not everybody realizes, that they have a lot of brown spots, or they don't realize that their texture is real bad. So the Vizio looks at 8 different characteristics of the skin that have to do with aging. So it's very, very informative. Our little waiting room. So for the consultation and treatment planning, when you're coming in for non-surgical, you meet typically with me. Myself or Dr. Camp are the 2 providers that are involved in the treatment planning. And so when you come in, we do what's called a good faith annual exam. So it's kind of like when you go to your regular doctor and you go for your physical exam. That has to do with the medical side. There's actually one of those that we perform for the aesthetic world as well. And so we really like to make sure that we cover everything, that all your questions get answered, that you have a really good grasp on what we're doing, why we're doing, how it will help, and what that next year's worth of planning looks like. And the plan is very fluid. It can change based on how good you start taking care of your skin. If you, one summer end up on the beach for 3 weeks in a row and your skin, has had a lot of exposure to the sun, UV damage, maybe you got burnt a couple of times. Obviously, those types of things are going to change what our treatment plan looks like. We may need to add or take away or kind of shuffle, very much like, if you went into your regular doctor's office and you had high blood pressure and you started on a blood pressure medication, are you now dieting and exercising? Like, can we, change the dosage, things like that. And so that's kind of how that works. Consultations are usually about 45 minutes if you've never been to our office before. If you have been to our office before and we're just kind of doing your annual review, then obviously a lot quicker than that. But we want to make sure that we take care of any questions you have and address any sort of treatment you're considering so that you feel well informed in taking the next step. Home care and follow-up information. So we do a lot of things, a lot of procedures here that, you know, when you go home, you might have swelling, you might have bruising, you might have redness. There's a lot of things that could happen outside of our office that we want you to make sure you can feel open to communicate with us. So we have the ability with our electronic health record system to have patients text in a lot of their questions. Sometimes patients will text in photos to keep us updated on what's happening with their progress, whether that's, you know, healing from a laser or if that's swelling from getting filler, and that text line is actually secure. So it's fully HIPAA compliant, which means, you know, security wise, nobody's going to get access to anything that has to do with your treatment plan. So it allows us to really, oh, we got one more person coming in, sorry. It allows us to really stay up to date with what's going on at home for people without them having to come back up here. Sometimes that's not super convenient for people. We do provide home care cards. This is kind of an example of one of those home care cards. We update things very frequently. So if we give you any additional information, let's say, you know, you come in for lip filler and I verbally tell you something that doesn't happen to be on this, that's because we're updating things constantly. And sometimes our physical take-home products don't always have the latest updated information on it, although we do update those pretty frequently as well. So bottom line, if you're ever in a position where you're not sure, please ask, please call. No question is a dumb question, and we have heard it all. So just make sure you communicate with us. Kristen probably gets lots of phone calls.
Yes, and you guys can text that number at any time, even if it's in the middle of the night. We will get here in the morning and check it and get back to you as soon as we can. So. And
honestly, sometimes the text line I feel like is a little bit easier to respond to just because we have several people checking it throughout the day. I'm not always available to answer the phone because I see patients throughout the day, but if I'm between patients, you know, on the computer in one of the rooms charting, I can click the button that allows us to view the text messages. And if there's something on there that's nursing related, then I can respond to that usually pretty quickly. So it's a great resource to have.
Especially for people who are working and you just want to like book a quick Botox appointment and you just want to text it to us, I can get back with you and just ask you like what day and time works. And it's just much quicker because I know that not everyone has availability from 9 to 5 Monday to Friday. So texting is always welcome.
Yes, absolutely. Emergencies. So I can't think of anything in particular that's been a true emergency, but certainly if there's anything that you are concerned about that you don't feel like should wait till the next day, please call us. You can always call the regular line and get a hold of somebody after hours. Obviously, that's something that should be utilized only for really urgent matters. Any sort of true emergency, obviously, you need to go to the ER for that. But concerns about your treatment plan or how you're progressing, we are 100% open to talking with you about that. We actually want you to communicate with us and ask us questions rather than Google. Sometimes Google doesn't always have either correct information or sometimes it's not the latest, most up to date. And everyone's individualized as well. So you can't always compare your results or your process to somebody else's. So. All right, so I think rewards and communication, the Happy Camper, Allie, Aspire, and social media. I think Kristen is going to be great to speak to these because she deals with them way more than I do. And then we'll talk about social media a little bit.
Yes, so Allie and Aspire, those are going to be 2 reward programs that the makers of Allergan and Galderma create for our patients. So let's say you come in and you get Botox and maybe a Juvederm filler, you do get points for that. And it's basically Allergan rewarding you for using their products. So, and the same is going to work for Galderma. Theirs is called Aspire. So if you wanted to get like a Restylane product, something like that, they would do the same thing and reward you. So it's basically just a way of saying, we appreciate you using our product. Here's some free money. So every 100 points is going to be $10. You do get some points for joining the program as well. So that's also really great. If you just want to join in, they'll give you some coupons every now and then. And sometimes they even have rebates. So those rebates can be really great. I know during COVID, they were offering like a welcome back rebate, and it was like almost $300, just free money. So we try to get every single patient signed up. We don't want to leave anybody behind on that, because it is a really wonderful thing, and it brings people back into our office, and that is trust and loyalty right then and there. So I make sure that everybody on their way out after any injection treatment gets that reward program signed up so they can earn their free money. So social media, we are constantly posting things every day on our Instagram. We do have Facebook as well, so you can check that out. But we're all really great. We have Stephen Camp MD and also Camp Bowtie Babes. So you can follow both of us and check out our stories and just before and afters, and just any education really is going to be the best on Instagram.
Yeah, so a lot of people will look on Instagram for before and afters. We do try to post as many of those as we can. Obviously, you know, back to the consent side of it, we have to have consent in order to do that. But it's a great place for before and afters, a little bit of education. We try not to make it super boring. We want to have a little bit of fun as well. So you'll see some silly stuff on our stories on Instagram as well. Dr. Camp does great before and afters on his specific one as well for a lot of surgical patients. So it's a great place to get information and to connect with us. All right. I'm gonna get out of here now. And gonna unmute everyone. If anybody has any questions, let me know. Now's the time. Let me make sure my volume is up. Yeah, my volume is up. All right, I don't see any questions that were typed in the chat at all. So if nobody has anything specifically, we try to go over everything, but if there's anything specifically you can think of, it's just a basic overview of kind of what you can expect coming into our office. So we're really happy you guys joined us. Everybody that jumped on today is going to get a $50 credit is that right? Okay, a $50 credit for whatever procedure you want to have done. So we're making sure that, Lindsay, thank you. Morgan, question on cool sculpting. How much is the first treatment? So very good question. And the answer to that is we need to figure out what your treatment plan looks like. So pricing for cool sculpting is based on how many cycles you're gonna need. I will take. Okay, so I just had to confirm. Right now, Cool Sculpting is doing this amazing thing where if you buy 6 cycles of Cool Sculpting, you get 6 cycles for free. That is outstanding. I have been doing Cool Sculpting for several years, and I've never seen such an amazing buy one, get one type of deal like this. So most people on average for one treatment, I would say most women on average, for one treatment for the abdomen, for example, would be about 4 cycles. And most of the time we're gonna treat that 2 to 3 times. So you can get an idea of what that looks like. Cool Sculpting is, yes, exactly. Cool Sculpting is $500 a cycle. So you can get an idea of what that would look like. But the best thing to do is schedule a consultation and come in and let us see how many cycles we think you're going to need in order to get what we call treat to complete, or the area is treated to the best of its ability. So,
and it is also part of Allergan. So on top of the free cycles, you would also get your coupons from Allie. So you can always get on that as well.
So yes, it is used for what we call submental fat, which is this little fat pad that's underneath the chin here. People call it a double chin. So cool sculpting freezes fat cells. Those fat cells then die. Your immune system has to come in and pick them up and get rid of them. So that process is a little bit slow. So it's not like you get treated, walk out, and you look the way you want to look. It takes a few months to get the full effect. So cool sculpting is approved there. There's a special applicator that we use for the submental fat. And if you were interested in doing the buy 6, get 6, but we're not going to put 12 cycles here probably, we can always assess other areas to see where else you can benefit from it. Because most people can benefit from cool sculpting in multiple areas. All right. Any other questions? I know they take a second to come in after you type it. So I just want to give one more minute, and then if you guys are done, then we'll let you go. How much Botox do you suggest on the first treatment?
It's a good question. I actually just had someone call in and ask that question.
So people ask all the time. What I can tell you is that Botox has already, the people who own Botox have done an enormous amount of research. So Botox is a medication just like any other medication. Dosing has been predetermined. So just like when you look at the back of the Tylenol bottle and it says you can take 1 or 2 tablets every 4 to 6 hours. Botox depends on the area you're treating. On average, most women will need about 20 units in their forehead, 20 units in the brow, and then 24 units split between the crow's feet. So that gets you about 3 to 4 months of no wrinkles. But obviously we want you to come in, let us assess you. You may not need that much. It depends on the surface area, it depends on a lot of other things. And that's where the assessment comes in.
And then this question says, should you be enrolled with the point system prior to being treated? So that is up to you. I will say that if you go ahead and enroll in Ally before you come in, as far as I know, you do get $10. So that way, when you come in, we can go ahead and just knock off $10 off your treatment. But you don't have to. You can always just get your treatment done, and then I'll sign you up right after your treatment and get that ball rolling for the future treatment. And I think that's all of our questions as of right now, because we'll give it a couple more seconds if anyone's typing anything.
I think these are going to be fun. This is kind of a first one. And yeah, I mean, we did a lot of Zooming when we were in quarantine, but I haven't done any for a while. So this is fun to get on here and do some more education stuff. Hope you guys have gotten at least a little bit out of it. And I'm glad to be able to answer questions. I'm like, everybody calls me the nerd in the office because I really like the educational side of everything. So I probably give you more information than you could ever want or need, but I feel like that's my job. So, and I love doing it. So.
If you guys ever have any questions, also with email, I check my email all day, every day. So you can always email us too. We're really great with that as well.
All right. Well, thank you so much, guys, for joining us. We'll let you get off here. And our next one will be, do we have the schedule? It's on our schedule. I just don't know the date. So once a month, we'll be doing a non-surgical Wednesday webinar. So obviously it's going to be on a Wednesday. And then once a month, we'll be doing a surgical. So that'll be with Dr. Camp. So if you have questions or concerns about surgical things, stay tuned. And if you want to know when the next one is, we can certainly keep you posted about that. So get on our Instagram and we can keep informed that way. Probably the easiest way to do it. All right, bye.
Thank you guys.